So policy, first of all, impacts distribution of resources and whether or not patients have access to innovative therapies or not, and to what degree and under what condition. So that's the general way policy impacts us in healthcare. Now, with respect to patients who have CKD, chronic kidney disease, those patients have a couple of different options of how their healthcare is paid for. So one is that they're paid for through what's called Medicare Part D, which is, I guess I'll say, the traditional way that most drugs are paid for. And then the other part of the payment is for the patients that get dialysis. They have what's called a bundled payment for their dialysis treatment. And so that bundled payment for the dialysis treatment, what's been happening over the years is that bundled payment has been getting, let's just say, increasing pressure has been put on it, with additional things being added to it, so that the providers that provide the dialysis have to do more with the same amount of money, or roughly the same amount of money. So basically what's happening today is the Kidney Patient Act is designed to continue what has been the status quo, which has been to allow patients to have access to their drugs through Part D, Medicare Part D, and not have their phosphate lowering drugs moved into the dialysis bundle. So that's what the Kidney Patient Act is about making sure that what has been the case for over a decade, which is oral drug therapies not being put into the bundle, oral drug therapies continuing to be a Part D paid for, Medicare Part D paid for, that simply continues. And so as of January 1, if the Kidney Patient Act is not passed, as of January 1, then what will happen is the oral drugs will move into this bundle, and then that will in some ways impact physician and patient choice on whether or not they get what they think is best for the patient. It will be conflicted with, or let's just say impacted by, what's going on with the dialysis provider and the bundled payment that they're receiving. And so we really just want to continue what's been good practice and have that continue going on. So that's what the Kidney Patient Act is about. So there's a couple of different ways. First of all, HR 5074 is the Kidney Patient Act. So if you just Google HR 5074, the Kidney Patient Act is going to come up. Now, how can they be heard? Well, if you don't already know who your legislator is, you should find out who that is, and even if you just send them an email or make a phone call to whoever your legislator is. Because the more your voice is heard, then they say, oh, when they're hearing it from other places, then they know that their people, their constituents, the voters in their area are concerned about HR 5074. Then they will know, oh, I need to pay attention to this particular bill, and I need to take positive action in this regard. So that's a very basic way. There are also organizations like HEAL, the HEAL Collaborative, the National Minority Quality Forum, who are doing things like writing letters to Congress. And so if you're part of an organization, you can ask, can our organization co-sign the letters that you are sending to Congress to say, we think that there's some change, that HR 5074 is a good thing, and we'd like to see that it be passed. And so those are two different ways. One is to work with the HEAL Collaborative, look at the National Minority Quality Forum, which also has a voice to speak up on this, and see if your organization can sign, or if not, then deal with your individual legislator.